Handling of the
Stop
coronavirus
the spread of
pandemic.
COVID-19.
The
More and
WHO
more
has been
cases are
sharply
popping up in countries far from the epicenter.
Madrid
continues to wage
COVID-19 has
all-out medical war to defeat the invisible enemy.
And in a usual 10-week period, there would be, on average, around 100,000 deaths in the UK.
Coronavirus disease or COVID-19 is an infectious disease caused by a newly discovered coronavirus. At this time, there are no specific vaccines or treatment for COVID-19. Why COVID-19 is very dangerous? First, UCL have stated that COVID-19 is more deadly than flu. COVID-19 could be about 10 times more deadly than the seasonal flu. COVID-19 is stickier than SARS-1. This virus also attacks the lower respiratory tract, the bronchial tube, and the lungs, where it can lead to the pneumonia. Each individual has responsibilities to fight against COVID-19, or at least reduce the spreading. Everyone, me and you. Yes, you. So what is our responsibilities? Or in this content, social responsibilities to help prevent COVID-19 from spreading. My friends will help me to list several steps for you. So buckle up, sit well, and take note.
During COVID-19 season, everyone must stay at home. They have a lot of free time, and one of their activities is they will do shopping online for food, clothes, and others. So, these are some tips on how to handle the delivery process. Have some ways of dealing with buying something from outside our house. Try to avoid yourself from buying many things because we need to minimize socializing. If we always contact an outside person, it means we can easily get the infection. When we delivering things at the parcel or food from the delivery, we need to care about our social distance. In COVID-19, we must be careful and not to trust anyone, especially from outside people who expose themselves with many people. We need to provide enough money and put it in the plastic bag. If it has change, the sender must put the change money in the plastic bag. The parcel and change money just leave at our outside home for at least 8 hours. However, it is easier if we buy by using online payment. So, the delivery just leave our things at some safe place without meeting us. From this situation, ourselves and the sender can be safe and decrease from getting the infection of virus COVID-19. If we use service delivery, we need to respect the reader because he has many orders to send on time. As a consumer, we need to give cooperation. Try to take our things as soon as possible when the rider arrives at our house. Make the process of tag and payment easy without doing anything troublesome to anyone. Then, we did not need to be friendly to the rider and enough to say thanks to him. So, we can shorten our time to be outside of our safe zone.
What is social distancing? Social distancing, also called physical distancing, means keeping space between yourself and other people outside of your home. To practice social or physical distancing, first, we need to stay at least 6 feet above 2 arm length from other people. Second, do not gather in group. Third, stay out of crowded places and avoid mass gatherings. Keeping space between you and others is one of the best tools we have to avoid being exposed to this virus and slowing spread locally and across the country and the world. Why practice social distancing? COVID-19 spread mainly among people who are in a close contact, which about 6 feet for a prolonged period. Spread happens when infected person cough, sneeze, talk, and droplet from the mouth or nose and lodge into the air, land in the mouth or nose of people nearby. Tip for social distancing: follow guide from tourists where you live. If you need to shop for food and medicine, at the grocery store or pharmacy. Stay at least 6 feet away from others. Also consider others options. A. Use email order formulation if possible. Consider a grocery delivery service. C. Cover your mouth and nose with cloth face covering when around others, including you have to go in public, for example, to go grocery store. 4. Avoid gathering of any size outside your household, such as friend house, park, restaurant, shop, and any other place. The advice apply to people of any age, including teen, young teenager. Children should not have in-person play date while school is out. To help maintain social connection with social distancing, learn tips to keep children healthy while school out. 5. Work from home when possible. See additional information for practical instruction. Work for External Icon Cybersecurity and Infrastructure Security Agency (CISA). C. Avoid using any kind of public transportation, ride sharing or taxi is possible. Lastly, if you are a student or parent, talk to your school about option for digital distance learning. Thank you.
Here, some suggestions under specific circumstances and situations. First, for those who become unwell with coronavirus symptoms. If you have some fever, runny nose, or cough, you need to assume that you may have the coronavirus. Note that testing will not be possible for the vast majority of persons, as tests are limited and we should reserve them for contact tracing, stopping clusters, seriously unwell individuals, and older ill persons. What you should do is to self-isolate. If possible, use a bedroom with an attached bathroom and stay away from everyone, including your family. Your family or friends should be responsible to bring you food left outside the door, and utensils returned should be picked up with gloves to be washed thoroughly with soap and water. Avoid sharing towels and any items for personal hygiene. You will need to keep yourself meaningfully occupied by reading, using the internet, etc. This could be a good time to connect deeper with our Creator. If you are well enough, you can do light exercise in the room or garden. How long should you remain in self-isolation? This is uncertain. At least 7 days, but possibly 14 days. Second, suggestions when shopping at the supermarket. We will have to make intermittent visits to the supermarket to stock up on food, supplies, and other essentials. Be mindful of the trolley bar that we hold. Best to clean and wipe it with an alcohol spray. Best also to bring your own bag to avoid using supermarket plastic bags except for the wet items. Try to keep a distance from other people as much as possible, especially at the checkout counter. Be careful with touching lift buttons, traveling in lifts, and car park buttons. Lastly, dealing with visit to hospital or clinic. Hospital and clinics are high-risk locations to visit, and we should avoid going to the hospital unless necessary. Those with planned visits for chronic illness should try and arrange for limited waiting times. This would mean that we can arrive 10 to 15 minutes before the visit, see the doctor, and go off quickly. This can be arranged if we improve the efficiency of our health service at this time and offer mobile appointment services. We must limit the number of people waiting to see a doctor in the clinic, especially waiting areas. If you are unwell, tell the counter staff immediately when you arrive, so they can give you a mask and keep you away from others. Now, it's the time to work together and share our resources. If you have extra masks and hand sanitizer, consider sharing with those who do not have any. If you have some financial resource, consider sharing it with people or those who will be hard hit by the loss of daily paid jobs.
Good personal hygiene habit and wash your hands. The virus easily spreads through the breath and by the contact. Transmission can be prevented by proper hand washing. Proper hand washing is one of the most important ways to prevent coronavirus infection. There are proper ways to wash your hands. First, wet your hands with soap and water, followed by scrubbing hands for 20 seconds, including between finger and under nail. Finally, hands should be rinsed and dried. Single-use disposable paper tissue is the best. It is important to wash your hands frequently, especially after using toilet and before eating or handling food. Hand washing is a simple practice that can help to protect you and others from coronavirus as well as other infection disease. Alternatively, use an alcohol-based hand sanitizer. Let's relook how to use hand sanitizer. First, dispense the hand sanitizer on your palm. Rub well over palms, back of hands, and fingernail until dry. Waterless use for refreshingly clean hands. Okay, next. Cover your nose and mouth when you cough and sneeze with the inside of your elbow. And if you sneeze, use a paper tissue and discard it possibly in a closed bin. Next, don't touch your face because that surface is easy to COVID-19 infection. Lastly, keep surface clean. Among the things we don't know about COVID-19 is how long the virus can survive outside of human hosts. Some cleaning tips. Use the right product. Clean dirty off of the surface with alcohol solution with at least 70% alcohol. Leave the surface wet with disinfectant for as many minutes as the product instruction require.
Hello, I will explain good information and disinformation about COVID-19. As we can see, COVID-19 has likely to affect people from many countries and many geographical locations. When we lack information during COVID-19, a person can experience anxiety and panic symptoms. The reason why they easily can get panic symptoms because lack of information, fake rumors and fake news was being spread by social media such as Twitter, YouTube and Facebook. How we to avoid misinformation about COVID-19? So, we should seek information only trusted source and mainly so that we can take practical steps to prepare your plan and protect yourself and your loved one. However, we must seek information update at specific time during the day once and twice. Get the fact, not rumors and misinformation. Gather information at regular interval from the World Health Organization (WHO) website and local health authority platform in order to help you distinguish fact from rumors. When we get the right information, we must protect ourselves and be supportive to others. We can find opportunity to amplify positive, helpful story and positive image of locals who have experienced about COVID-19. For example, story of people who have recovered or who have support loved one and are willing to share their experience. Lastly, we can share a simple fact about what is going on and clear information about how to reduce risk of infection COVID-19 in word order people or without cognitive impairment can understand. Repeat the information whenever necessary. Instruction need to be communicated in clear, concise, helpful and patient way. It might also be helpful for information to display in writing picture. Spread a good information and trusted source to others. However, we must be empty to all those who are affected in or from any country. People who are affected by COVID-19 have not done anything wrong. They deserve our support, compassion and kindness. Furthermore, do not refer to people with disease as COVID-19 case. It is important to separate a person from having identity defined by COVID-19 in order to reduce stigma. Facts can help to minimize fear, anxiety, stay home and stay safe.